Welcome back. I'm joined on this episode by Syl Trepanier, who is the Chief Nursing Officer for Providence Health. He's also a member of our TruMerit Board of Trustees, and it was a pleasure to sit down with him today. Syl shared that in his role as CNO at Providence, his primary job is to be the voice of nurses for the over 36,000 nurses employed across their multi-state health system. This position has given him a unique point of view on the day-to-day challenges and inspiring work of nurses in a post-COVID world, and continues to compel him toward advocacy and representation in every circle where he leads. It was a privilege to hear not only his thinking, but his heart for the profession today, where it's growing and evolving, and where nurses need to come together with a collective voice to continue to advocate for truly transformational care delivery. So don't go anywhere. This episode starts now. In this podcast, we're setting the table for some powerful discussions with nurses, allied health professionals, regulators, tech innovators, and other thought leaders across the globe. Welcome to Care Anywhere, the Global Health Workforce Podcast, brought to you by TruMerit. Hi, everybody. Welcome back to Care Anywhere. I'm your host, Lea Sims, and I am joined today by Syl Trepanier, who I'm so excited to have on the podcast today. Syl is a member of our Board of Trustees, is a CNO with a big health system. He's going to tell us a little bit about that. Welcome, Syl, to the podcast. I'm so excited to have you.
Well, thank you. It's great to see you, Lea. Thanks for having me.
Yeah, tell us a little bit about yourself and introduce yourself to our listening audience and viewing audience.
Sure. I'm a nurse executive, as you just mentioned. I work for Providence Healthcare, which is based in Renton, Washington. I have the honor to serve as their system chief nurse. What the heck does that mean, right? Yeah. And essentially, I'm the voice for the nursing profession for the entire system, which is something that I take very seriously. There's roughly 36,000 nurses who practice at Providence in 7 different states. Wow. So it's big responsibilities that I take very, very seriously, as I said, and it's a huge privilege to be able to serve in that capacity. I also serve additional ancillary services that support the entire healthcare team. My primary responsibility is to help and bring the voice of the nurses at the executive table.
Yeah, what an incredible privilege, not just a responsibility to be the voice of 36,000 nurses. And I don't think I knew that number until you just said it. So kudos to you, because I'd love to talk about, and I'm sure our audience would be interested in, so many nurses that listen, how you evolved your career and found yourself in that place. So let's start with the question I ask every nurse on this podcast. What inspired you to get into healthcare to begin with, to become a nurse? Mm-hmm. It is, one of the most honorable, trustworthy professions that I can think of, and certainly one that we spend a lot of time talking about here. Everyone has a different story for how they got into the profession. For some people, it was a sick family member that inspired them to step into healthcare, or they have family members in the nursing space or in medical space. What got you involved in this profession?
Just that, a sick family member.
Family member.
I was pretty young age, not even 10 years old, and my dad was diagnosed with a late onset of type 1 diabetes. I mean, I saw my dad literally shrink in front of us. My dad was 5'7", and he weighed at the time like 250 pounds, so he was as wide as tall, if you will, and then in a matter of less than a year, just like got down to barely 120 pounds or something like that. Don't quote me on the numbers, but it's pretty much how I remember them. And we thought we were going to lose him. We had no idea what was going on, and he comes back from the hospital and he's diagnosed as a diabetic, and he comes with his insulin bottles and all that good stuff. Those were pre-glucometer years, so these were during the years where people had to pee in a little tube and add a little colored pill, and then depending on the color, they would identify what their
On a
blood
sliding
sugar
scale.
level
Yeah.
was.
Yeah.
I was fascinated
I
by
bet.
all of this. Wanted to. I mean, of course, my dad, so wanted to
Yeah.
care for him, but it was way beyond that. I mean, I remember distinctly remember telling him that I wanted to learn how to give the injections because there could be a day where he might need some help.
Sure. Yeah.
And so I was just fascinated by that, and so I knew very early on that healthcare is what I is where I wanted to be.
Yeah.
And fast forward, then nursing school, and as I was entering in nursing school, I had two very specific dream as I knew I was going to become a nurse. The first one is clinically I was going to work to help diabetic patients. And in fact, as a student nurse, I worked in a camp for diabetic kids and helping children learn how to give their injections and how to live with diabetes from 6 to 12. So I did that the two of my years in nursing school, and I became a diabetic educator. Is that's what I did clinically. But the other pipe dream that I had as I was going into nursing is I would be a chief nursing officer. I didn't call it that then, but I would be leading
You knew
nursing
you wanted to be in
services.
leadership.
Yeah,
Yeah.
yeah.
That's so inspiring. No, I think those kind of stories, whether they exist in healthcare or in other industries, I mean, they instill in you at a young age the desire to care for people when you see people in need, and the desire to solve problems, to see a challenge and be part of the solution, which is so much of what we continually hear on this program is a common driver and passion for nurses. I hear so many nurses that don't just consider this a career but a calling. They feel like this is what I was meant to do, and a service role, and it's a continual theme on this podcast for sure. Thank you so much for sharing that. So let's talk about your journey into leadership, which is incredibly impressive. You've spent a number of years, obviously, at the bedside working. How did you work your way into the voice of 36,000 nurses that you are privileged to enjoy today?
I have a pretty traditional path into administration and leadership, management, administration, leadership, and within healthcare. So I practiced for a few years, and then made my way through in the emergency department. And while practicing in the emergency department, at one point in time, I had an opportunity to. I was asked to look at an opportunity to do a leadership role, and that's how it all started for me.
Yeah.
I was an associate director in the emergency room, nurse manager in the emergency room, and overseeing day-to-day operations and scheduling and all that good stuff. And I enjoyed it a lot, and I knew I wanted to do more of that, and I wanted to be able to inspire and influence bigger decisions that at the end of the day, no matter what they are, they impact the lives of those who touch the lives
Right.
and the souls of the patients that we care for. Became a director of multiple departments, and then an associate CNO, and then a CNO, and then a regional CNO, and now
Yeah.
a system CNO. So a pretty straightforward, upward trajectory.
Yeah. Yeah.
What I should say in all of this, though, is it was as much, what prepared me for the next role, from being an associate director to assistant chief nurse. Clearly the experiences, but what I was very fortunate to have is leaders around me that also saw the potential and coached me, mentored me, and pushed me also in getting additional education outside of the work setting. Whether my very first leadership management training outside of work. As I went to I was offered a grant to attend the Dale Carnegie Management Institute. That was my first outside of work, and learning side by side with managers and leaders that are not in healthcare. In fact, I was the only one in healthcare.
Wow.
Which opened up this whole world for me, and this understanding that it's very important to continuously develop yourself, and not to stay in your own lane, but to really open your views to the outside world, because there's so much to learn out there. And that was really eye-opening for me, and led to multitude of like experiences along the journey, up to and including, by that time when I first entered, I was already mastered prepared, and that was also part of the plan. I would get all of my education so that would be ready to grab the opportunity when it's out there. And it was not until multiple years later that I ended up doing my a doctorate in executive leadership.
You said two things there that I think are critical. I knew you were going to say mentoring almost before it came out of your mouth, because that's another thing we hear a lot of. I probably hear the word mentorship more from nurses than almost any other profession that I've talked to over my career. There is something about that caretaking nature that extends to each other in the nursing space that you don't always see in every profession. It's very inspiring. But then you also touched on how powerful that outside-in business point of view is, and I think that's probably something critical for nurses coming up through the ranks today to understand as well. Not all problems are going to be solved solely from an inside-out view of the healthcare system. There are times when there are business principles out there that could be benefited from within the system. So kudos to you for pulling all of those together to get where you are today. Let's talk a little bit, the powerful thing about the role that you're in now, and the fact that you came up through the ranks on that sort of linear upward trajectory that you talked about, is that it's not all from academia. It's really from being in the trenches of care delivery every day, and nursing at every level, and informatics at every level, that gives you the ability to speak with credibility and be the voice, I think, of all of those nurses now. So I'd love to pivot and talk about what you're seeing frontline and bedside today with nursing care. I mean, the State of the World's Nursing Report just came out. There's a wealth of data in there about the critical shortage and burnout of nurses, and concerns about nurse safety, and there's so many ways that we could take this conversation today, but you're somebody who's really connected to that in a very real-time way every day with nurses within your system. You have a lot of insight there. What are you seeing that is still a concern for addressing, and then models of care and staffing that you're excited about, that are actually making an impact on some of these worrisome concerns we hear frequently about the nursing profession?
Where I would like to start is reminding ourselves that healthcare is a microcosm of what's happening in the world out there. So we can't be surprised by seeing things that are happening in healthcare, because it's happening everywhere else. We're seeing more violence in our environment. We're seeing a lot of distrust in our environment, and that's no different than what we're seeing everywhere else. So it's there too.
Yeah.
And because of those two things, it requires everyone, from the bedside to the boardroom, to communicate now more than ever.
Yeah.
And it also requires for each and every one of us to offer each other a little bit of grace here. It's just been so wonky post-pandemic. We have just not settled. The world has not settled by any stretch of the imagination.
Nor will it ever be the same. So it's going to
No,
settle in a new place if it
yeah,
settles. Yeah.
and that's not bad in it by
Yeah.
itself, by the way. I do believe that, but the transition is really wonky and it's really hard to catch your footing in all of this. And I don't think that we offer each other enough grace in this period. It's this notion that because because you lead all of the efforts at TruMerit as it relates to marketing and social media and all that stuff, that you're supposed to know all the answers, and how
Right.
dare you don't know the answers, and how dare you make a mistake. Well, it's the same thing for me, right? And I could just go down the list with
Make that my
everyone.
boss, right? Peter, I'm just kidding.
I mean,
Yes, you're right.
my point here is that we are all living in a world that is so different that we just have to give ourselves a minute here.
Yeah.
And I get that some of us have some huge responsibilities and we can't afford to make mistakes in certain place, and I get that, and I'm certainly not using this as an excuse to not to hold myself and others accountable in this space, and this goes like right all over the spectrum.
Right.
So having said all of this, I think that that's why it's important to communicate, that's why it's important to connect, and that's why it's important to be connected with the work that occurs. I haven't touched a patient in a really long time directly. Now, when I go into a hospital, do I spend time on a department where care is rendered? Yes. Do I enter a patient's room? Yes. Do I have conversations with patients, conversations with nurses? And so that's my way of getting getting connected.
Staying relevant.
It's
Yeah.
not below me to go into a room that there's a light that's on and then walk outside with gloves on and a bedpan.
Yeah.
I mean, right? I don't mind
Right.
doing that stuff. In fact, it reconnects with the purpose of where it all began, and
Sure.
helping patients, and helping patients out and helping the teams. So it's important to stay connected, to have the lines of communication, and it's important to have this bi-directional grace that we're all learning something new. And to that end, I think that, and you alluded to that in your question. You said you're excited about models of care
Yeah.
and the likes.
Well, we just hear so much repeatedly about burnout and shortage and all of the concerns, the worrisome things, but there are so many exciting things, innovative things that are happening collaboratively, as you said, to address some of those, and we're not there yet. I know that you're doing those at Providence, and our audience would be interested to hear those.
Yeah.
So we're not just dwelling on the metrics.
On the
Everyone wants
metric.
to look at the metrics, right? All the numbers, but
Oh my God, yeah, right. Let's just let's be paralyzed by the fact that we're just enamored by the problem, and
Yeah.
and look it through, and here is the aha moment for me, probably 2.5 years ago. At that time, I'd been a nurse for 34 years, because it's going on 36 years this year. But a nurse for all this time, the entire world has changed around us. The technology has changed, medications have changed,
Yeah.
but how we approach the work is pretty much the same way. And there's something fundamentally wrong with that. So what we've been doing all these years is just borrowing Peter to pay Paul. Nurses have been going from one system to the next, from one hospital to the next, to come to realize that they're not happier over here or over there, because there's one common denominator in all of this. The work is the same.
Yeah. The
The
patient
conditions might be
experience is the same,
different.
too.
What was that?
The patient experience is the same too. I was just telling somebody the other day, I'm 57, and my experience of making an appointment and going to a doctor and sitting in a waiting room and going back, it is the same as it's been since I was a little kid. And some of those processes are good, but many of them have not changed. I think you're talking about the fundamental approach to things that might need changing, and not just the peripherals around
Yep.
that. Sorry, I couldn't help but
Oh,
be in there, because
no,
as a patient, I could say it doesn't look
I'm
like it's changed much from the. I'm still filling out a clipboard when I go into.
I know.
when I go
Well,
into any of my doctors these
well,
days.
here's what
Occasionally they'll hand me a tablet, but usually it's still a clipboard that I'm filling out
and the sad part is you probably completed all of those forms
online. I did.
online, and then they ask you to
They
complete them
did
back
every
again when you
time.
showed up.
Yes.
And the only industry that the first bill that you get is so many pages, and what it does it say on the top of it? This is not a bill. You can't make that stuff up, right? It's
Yes.
just unbelievable. So I'm right there with you. So many things that we need to change. And here's the danger zone for me. I believe that the status quo is the biggest risk for healthcare today.
Yeah.
The status quo is the
Yeah.
biggest risk for healthcare today. And what I worry about is that we have not reached enough of a critical mass of individuals to understand and to wrap their head around that. We still have some colleagues who believe that we just need to keep on doing things the way we do them. It's going to be fine. It's not going to be fine. Worldwide, we're going to be short 13 million nurses like tomorrow morning, which is by 2030.
Yeah.
We've never had enough nurses, if we're being fully honest. I don't
That's
think we've
just to
ever had enough
minimally
nurses.
staff, not necessarily
That
to even
yes,
provide the
yes,
kind of care you really want to provide
yes,
to patients
yes,
globally.
yes.
Yeah.
And we've approached nursing. When I graduated, this is what we were all learning. We all approached nursing, approaching it from a primary care, total patient care model. We had lots of evidence and science around why that was important to approach patients that way. And those were during the years that patients stayed with us on an average length of stay of 7 to 10 days.
Yeah.
That's not the case anymore. The complexity of their cases are very different. And I can no longer wrap my head around the statement that nurses need to practice at the top of their license and in the same breath say, and they need to be all things to all people. Those two things don't work together. It has to be one or the other. And I choose to be on the camp that says they need to practice at the top of their license because that's what our patients deserve and that's what they need. So that means that nurses, which I include myself in this conversation, that's the call to action here. The call to action here is let it go. Let go of stuff that others can and should do so that we can be experienced as the professionals that we were formed to be.
And what a time to say that, because despite all of the metrics we read and all of the concerns about workforce shortage and development, I continue to say there's probably never been a time that it would be better to become a nurse. I recommend this profession all of the time, and not just because of the caretaking, admirable nature of it, but because nurses enjoy an influence and a voice and an ability to shape the direction of healthcare more than they ever have before. So your advice for them to push out of and get out of the things that can be passed off, and to really focus on that top of licensure, maximum influence, maximum impact, is so timely. I think it's the greatest recruiting message for nurses right now. Not only are you needed and in great demand globally, but in most places, not all, you're going to be stepping into nursing at a time when care transformation is actually being increasingly led by this profession.
Yeah.
And the responsibility and the privilege now of having that voice comes with it, as you say, the responsibility to let some things go and to shift maybe even the self-view that nurses have had about their value in the system, because that's greatly changing. Your thoughts on that, about how maybe versus 30 years ago or 36 years ago when you got into the profession, what the hardest working advocacy group I know of really is nurses, and I am always touting nurses as an example of what continual advocacy for their profession looks like. I don't know of any other profession that has advocated for themselves better, whether it's on Capitol Hill, regulatory issues or whatever, or even within their own health systems the nurses have. But your thoughts on the change and what you've seen over 36 years and the influence you can have today as a nurse versus maybe when you first entered the profession?
No doubt that we are more organized than ever. One of our problems, though, is that although we're so many millions strong, we don't necessarily approach our advocacy. Not necessarily. We do not. I know that for a fact. We don't approach advocacy with one voice. We have too many different voices. So we need to figure that out.
Unified voice.
And that's entrenched into how, from how we are formed, and the various levels that you can get into this. You can get into this discipline being formed very differently, and yet you do an exam and we all show up the same way, and
Right.
we're all expected to do the same thing. And we have so many different ways and entry points, and it's that also, that's an ongoing conversation that we've had internally, that we need to have internally. But how we approach things and how we advocate for our profession, we need to have one single voice, and we don't have that today. So better than it used to be, but it's still it's still wonky.
Yeah. But more innovation being led by nurses. We see more nurse entrepreneurship than we have in the past, and a lot
Yes.
of innovation in health systems. More nurses in demand by tech companies than I've seen in
Yep.
all my years in HIT.
Yep.
There was a time 20 years ago, 25 years ago, when they were going after doctors for tech development, and now I see them more and more looking for nurses to develop patient-centric technologies, and who better
Yep.
to do that. And so that's an exciting development as well, because not only is that great for the patient, but it's more career path opportunities for nurses beyond frontline bedside care, for sure. Can you talk about some of the innovative? I know one of the when I first came to CGFNS, it's been almost 2 years ago, one of the very first things that I remember doing in that first month was coming to the board retreat for CGFNS, and you and a colleague from Providence got up and talked about some of the innovative models of care and staffing that you guys were instituting there. Could you talk about that a little bit and share some examples of what you're doing? Because I thought I couldn't take notes fast enough that day. They were, I was just learning the ropes, but I found that particular session to be very informative and eye-opening.
Doesn't matter how good we are at recruiting and retaining nurses, we're just never going to have enough. So we're clear about that at Providence. And to that end, we've invited nurses to lean in and with us, and reconfiguring and redesigning, deconstructing their role as they know it today, so it can be constructed in a way that it is meaningful to them and even safer for our patients. I'm going to give you a very short version of a 2.5 years storyline here, but essentially we deconstructed the role and looked at the population that we serve on certain units, looked at their needs, identified what their needs are, and then once we see what those needs are, that translates into activities that need to be done. What are those tasks and activities? And then ask ourselves, who should be doing that? And can it be done virtually? You see, there are some things that nurses have been doing traditionally that an unlicensed individual, properly formed, properly trained, properly educated internally, can do. We need to let go of that and allow these people to do that, so
That's
that the
what
nurse.
you were talking about with letting go, right?
That's it.
Yeah.
So delegation, which is a really hard skills to learn. I find in my experience that nurses are not very good at delegating. And when you approach the work through a team model, you have to be able to delegate so that you can leverage the entire team. So
When you
for
work
us,
hard to claim a domain, it's probably hard to let some of that go.
Well, yes. Plus, this, parentheses here. Now that you've said this, uh, it's yes, and to a certain extent, we've developed this notion that nurses are valued by the amount of check boxes that they're checking, by the amount of things and activities that they do, which is wrong. And that's what we're aiming to change here. I mean, in my mind, nurses, at the end of the shift, it shouldn't be their feet that should be hurting, it should be their head.
Yes.
And it's not the case today.
Work product versus work knowledge, right?
Yes.
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 Yeah.
Like many other professions.
Yes.
I think about our physician colleagues, for instance. They don't value themselves by the number of chest tubes that they insert in patients and and the likes. It's by the knowledge that they bring for patients to be cared for. I fully recognize that there are certain, somebody needs to be doing the work, right?
Yeah.
And that's fine. And certainly nurses are there on a task perspective to render certain care. But there's certain care activities that you don't have to be licensed to do. And that's what we need to. That's the mindset that we all need to have, and we need to let go of that. We need to stop valuing our profession by the number of things that we're allowed and that we should be doing. Right. That's wrong, in my opinion. So in this model, we're enhancing those capabilities and the fact that nurses can practice to the top of their license, and then the whole team does that. And the nurses have created for themselves the ability to work in a triad partnership where there's a dyad that's at the bedside, a technician and a nurse working collaboratively together, taking care of the activities of daily living, the medication administration, and the treatments that need to be rendered to the patient. And then everything else is done virtually by a nurse. Beaming into the room and then caring for the patient. Now, virtual nursing in the acute care setting is not new anymore. And some people were even doing it before we did. What's different for us is we change the entire composition of the team and approach the work together, showing up as a team. And it's hard work. It's change management on steroids, so it's not easy for the whole team. And here's what we know: we know that even in the short term, we're not breaking anything here. In other words, we're not creating an environment that's unsafe for patients.
Right.
So that's not happening, which is really what you want to know in healthcare, right off the bat. We know that for a fact. What we also know is that over time, people get more comfortable in it, and then you get into a rhythm, and then you start to see tons of operational efficiencies that are needed for our patients, but also needed for our nurses. Yeah. Here's how I would describe it. If you compare those, and we call this model co-caring model internally. If you look at co-caring units today, and you compare them with like units, or even compare themselves to prior to being a co-caring unit, we retain the staff on those units at a much higher level than anywhere else. Yeah. Nurses, technicians will answer with their feet. They'll make decisions with their feet. They will either stay or they will go. And they'll go someplace else. They're not leaving as much anymore. And the last thing that I will say about that, and that for every virtual nurse position we post, we have about 100 applicants. I've never seen that for any nurse position posted before. And now we're inviting and creating an opportunity for nurses to stay way longer in the profession. Yeah. Yeah. To be able to serve the patients and their communities. So it's a win-win-win for everybody.
For me particularly, because I spent quite a bit of time prior to coming to CGFNS working on telehealth solutions, especially during COVID. and working with ATA on a lot of that narrative. And the concern was when COVID sort of evolved and things went back to normal, that people would go back to non-virtual means of providing care. We saw a lot of telehealth deployed in acute care, in patient rooms, simply to prevent people from burning through PPE, going in and out of patient rooms. But then you would see that sort of fall away after COVID. And I remember thinking, as you had articulated earlier, this is obviously this is a crisis moment, but it's also a tremendous opportunity for transformation. It is nudging healthcare to adopt new models and new ways of reimagining care that we hoped would not revert back to pre-COVID practices. I think that's true across a number of industries, but I certainly was mindful of it in healthcare. So it's exciting to see health systems where now we're moving forward with virtual capabilities and hybrid tech opportunities for patients that some of the reimbursement issues are still a question mark over a lot of that stuff, and a lot of advocacy around that. But I have to say, when you shared this at that board meeting, I'm like, it's so great to see a hospital that says, no, we're not going backwards. We're actually going to continue. This wasn't a pandemic fix, a temporary thing to treat our patients or to get through that crisis, but we actually learned some valuable things about how patients want to consume their care, the convenience of it for them, as well as in the nurses. So thank you for sharing that, and I think that's exciting. We're closing in on our time, but I did want to say I know that nurse safety is another issue that has come up quite a bit, and I know that's tied to your front end statements about, hey, we're living in a different world now. Mental health and violence and trauma are on the rise outside of health systems, so of course they would be on the rise inside. You are involved in a task force with us specific to safe staffing through care model evolution, and I imagine virtual staffing is one answer to keeping nurses safe. But could you talk about the work of that task force and what you guys are focused on, and maybe some of the outcomes you're looking to drive through that collaboration?
Yeah, the aim here is to develop a framework that would eventually translate into some guiding principles that as you think about transforming and changing your model of care, here's some key indicators that some key guidelines that you really ought to be thinking about, and go one click down, and those guidelines, which are inspired by a framework, that those guidelines also are based on some experiences that we've had all over the world. We're deliberate about trying to find out what's going on elsewhere, where a particular piece of the puzzle may have, it might be well executed in this country as opposed to the United States, for instance. Highlighting the work that we do here, because we do some amazing work here. But there's also a lot of work and amazing work that is being done outside of the United States, with the ultimate goal. Imagine that we have this list of exemplars that everyone could access on how, if they're trying to be better at customer service in a community-based setting. Here's who's doing it really well, and here's how they've done it, and here's the technology that they've used, and here's how they completely reinvented themselves. I am in awe about the work that is happening with one organization that we do business with in Ghana, where we're essentially deploying ultrasound technology out in there's rural and there's rural environment, and how it's demonstrating that it's decreasing mortality in pregnant women, for instance. I mean, that's huge. Mortality amongst women of childbearing age is still crazy high in this country. It shouldn't be. And yet we have, countries like Ghana who are working on, on deploying certain, technologies. So we have so much to learn from one another. So if anything, we're creating the space. Yeah. We're creating the space to have the conversation and start to identify some exemplars, and building a framework to inspire others. Because at the end of the day, we could be. It's very easy to use a blanket rhetoric that says, safe staffing is really important. Heck yes. Well, who's going to argue with that? No one's going to argue with that. Yeah. We need to stop, we need to feed, I'll say it this way, I'll say it positively. We need to feed and flood the news, the literature and the likes with not only identifying the problem, but proposing some solutions to what the problems are. Otherwise, the only thing we keep on doing is we're admiring the problem, like we talked about earlier in this conversation, and not doing anything about it. And so what? Yeah. Right?
Analysis paralysis, they call that, right?
Yeah, that's exactly. So that's the call to action for every single one of us, no matter where we are, no matter where we find ourselves. If you find yourself in the spot where the only thing you do is to keep articulating a problem, then you're part of the problem.
Yeah. You're obstructing forward progress in those instances.
Yeah.
Well, thank you so much, Syl, for joining me today and sharing what you guys are doing at Providence and how you're leading so well and with so much passion. We are certainly blessed and grateful for your partnership and leadership with our organization. I've loved talking to you today. My last little question would be, what are you most hopeful about? A little quick last nugget for our audience. What makes you hopeful for the future of the profession for nursing?
I know that we have such an important perspective. We have a holistic perspective that is more and more acknowledged as required for us to identify the solutions of the future, and that gives me a lot of hope.
That's great. Thank you. On that note, we're going to wrap up. So appreciate you being here today. For our listening and viewing audience, thank you for joining us, and we'll see you on the next episode. That's it for this episode of Care Anywhere. Thanks for joining us. We hope you'll tune in for future episodes where we will continue these powerful discussions about our global health workforce. If you missed any episodes, you can find them at trumerit.org/podcast or by subscribing to our channel on your favorite podcast platform. Just look for our podcast logo or search for Care Anywhere to find us. Thanks again, and we'll see you next time.